Hello and welcome back to the Advanced Clinical Educator Training, delivered collaboratively by the University of Chester, the University of Central Lancashire and Manchester Metropolitan University. My name's Laura Graham and I'm one of the lecturers and practice placement facilitators at the University of Chester. And today's bite-sized training session is all about creating a supportive learning environment for our learners. Today's session will roughly be about 30 minutes long and we'll be covering the following topics. We'll have a little look at how we can make our placement environment supportive for our learners. We'll have a little look at giving effective feedback to a learner and boosting a learner's confidence. And finally, we'll briefly have a little look at how we can support struggling students out on practice placement. So I'd like to begin by asking you to think back to when you were a student and you had your practice placement coming up, and have a little think about all the thoughts and feelings that you were experiencing back at that time. It's likely to be a whirlwind of emotions and lots of different feelings. I've listed just a few here that potentially you might have been feeling back when you were a student, or what our learners might be feeling when they're approaching their practice placements with you. So just to give a few examples, a lot of our learners might be feeling quite anxious and nervous about coming out onto practice placement. They might find it quite an overwhelming experience, or they might be a little bit worried about what to expect and what's expected of them. They might potentially be quite stressed, worrying about juggling their placement with other responsibilities outside of placement, such as family or work commitments. Some students might be feeling quite excited to come out on practice placement and apply everything that they've learnt. Others might feel quite doubtful and doubt their abilities and be worried that they might not be where they need to be at for their practice placement. And we know that learners tend to start practice placement at slightly different levels, and some learners will advance a lot more quickly than others. So you might find some students are feeling quite anxious and worried about whether they're going to meet the expectations of their practice placement provider. Others might be worried about timings and time frame of placements. They might be concerned about whether they're going to complete and pass the placement within that relevant time frame. They might be worried about what their timetable looks like and what does their week look like. Is it going to fit in with their commitments outside of placement? Others might be concerned about the journey and the travel involved with placement. We know some students don't drive, or they may be nervous drivers, and so they might be worried about getting to and from the various different areas that they're required to attend during their practice placement. And we also know that finances is a big one as a student. Often students are really worried about how they're going to financially be able to afford to be out on practice placement for potentially 10, 12 weeks without an income. So definitely something that plays on students' minds and is a real worry for a lot of our students. We have students that potentially are carers or have children that they need to care for outside of their practice placement as well, and so that can sometimes be a worry and a concern for our students. Some students will be worrying about if they fail their placement, what happens, what's the procedure and what's the process for if I don't make it to the end or I'm struggling partway through my placement. And often we forget that a lot of our students are relocating for their practice placements. They might be away from their support network, their friends and their family that are normally nearby to be able to support them. So often some students might feel quite isolated and quite lonely whilst they're out on placement. So a whole host of emotions and worries and thoughts and feelings associated with going out on placement, and it's our job as practice placement providers to ease those worries and concerns and to support our students and to make them feel welcomed and valued on their practice placement with us. And to start by doing that, it might be quite useful to have a think back to your placements and what your experience was on your practice placements. Did you have a very positive experience, and what was it that made it so positive? What did that placement provider do to make you have a really positive and successful experience on your placement? And vice versa, if you have had perhaps more of a negative experience out on placement, what was it that made that experience more negative? What could they have done to improve, and how can we take that forward when we're supporting learners to ensure that they don't have that negative experience? So I'd encourage you to just take a few minutes to have a little think about your experience and what it was that you feel went very well, and what were the areas where things could have been improved and perhaps you could have felt a little bit more supported in certain areas. And keep that in mind when we're planning and supporting placements for our dietetic students. Okay, so we're going to have a little look at how we can make our practice placement as supportive and effective as possible for our learners. And there's a few topic areas that I'm going to hone in on today. We're going to have a little look at first impressions and that first day of placement for students, and remembering that first impressions count. We're going to have a little look at student confidence and how we can support students to build their confidence when they're out on practice placement with us. We're also going to consider how we can make students feel valued and heard and listened to whilst they're out on placement to us. And as I say, finally, we're going to have a little look at giving effective feedback to students and boosting their confidence further with some really constructive feedback, including both what's not going so well and what they can improve, but also what are they doing a great job of at the moment? What have they really managed to get down to a T and do very, very well? So let's start with first impressions. And I know that starts on day one in terms of how the learner's experience is from the outset, from that very first day of arriving on placement, but it also includes before they come out on placement with us, what support did we provide them, what contact and communication was provided prior to placement. So it's really important that we're welcoming our learners both on that day one, but potentially even maybe a couple of weeks before they're due to start on placement, and just introducing ourselves virtually via email, introducing them to perhaps their timetable or a welcome pack with some information about the hospital trust, about the placement, about the team, and perhaps some useful information about things such as parking permits, where to go on their first day, who's going to be their lead supervisor, anything like that that's going to sort of inform the student and make them feel part of the team and welcomed before they even arrive. So really thinking about those weeks prior to them starting placement and making sure that we can provide them with as much information as possible, if able to do so. That can really make a brilliant first impression for students coming out to you. But we want to make them feel valued, we want them to make them feel included, and we want them to make them feel safe. And to do that, we want to make sure that any queries are answered, that they're guided through the process of induction and orientation, that they know who their key members of staff are, that they can approach for support and guidance, and that when they walk into the office or they approach the team on placement, that the effort is made to welcome them and to introduce yourselves and to check that they're okay and how is their day going. Is there anything I can support you with? Was there anything you were unsure of today that I can help you with at all? All of those little things will just make a big difference to a learner when they're feeling quite anxious and quite nervous on that first day or first week of placement. So making sure that we welcome them, and as I say, that includes prior to placement as well, making contact, introducing yourself, introducing their lead supervisor, providing them with as much information prior to placement as possible. In terms of that induction, it's really important, as I say, that the learner knows who the key members of staff are that they can contact for support, and who is it there and able to be approached whenever the learner has a query or requires some further information. Who's who and who's best to approach for certain scenarios can be really helpful. Also considering, as well as that lead supervisor, has the student got a mentor as part of their practice placement? So usually a mentor is somebody separate from your team, or somebody that perhaps the student isn't with on a daily basis, that they can approach if they feel they've got any concerns or queries that maybe they wouldn't want to go to their lead supervisor or their supervisor with on a day-to-day basis, because they know that they're going to be with them each day, and they might feel awkward or uneasy bringing up a concern or a worry to them. So it's brilliant if you can allocate a mentor for your students or learners that's slightly separate to the team. It might be somebody from, say, the speech and language therapy team, or occupational therapy team, or it could be a specialist dietitian that, I don't know, works in paediatrics or works within mental health, that is separate to sort of the team that the student's going to be with on their placement. And having that mentor that they can go to, but also encouraging perhaps regular meetings with their mentor every couple of weeks, just as a quick check-in and to make sure that everything's going smoothly and that they're feeling okay. Also introducing them to the practice education facilitators, the PEF team, who can support learners on placement should there any issues arise or should there be any queries outside of the dietetic team. Also providing them, if possible, with an allocated space where they can come in the mornings, they can drop off any kind of resources, bags, coats, lunch, etc. And perhaps they've got a space where they can do a little bit of work or a little bit of prep prior to going out with the dietitian that day. So giving them their allocated space if possible. I know that's not always possible. I know a lot of the time we hot desk and space can be quite limited, but if we can give them some space or area where they know they can go, it can often make them feel a lot more included, and make them feel like part of the team if they've got a little space in the office to sit. Providing them with any resources, policies, procedures as part of that induction procedure and policy as well, to help them to kind of adjust and get used to how your trust does things, because every placement will do things slightly differently. So really important that they're given your policies, your procedures, your standard operating procedures as early as possible, so they have time to really familiarise themselves with those and get used to your trust way of doing things. And I think I've already mentioned this about these important key contacts, so knowing who their lead supervisor is, allocating a mentor if possible, introducing them to the PEF team, also introducing them to other members of the multidisciplinary team that they might be working closely with whilst they're on placement, and any other students that might be out on placement with them, whether that might be other dietetic students or whether that might be other AHP students or medical students. Often we can support that peer-assisted learning or that collaborative learning model across different student courses and areas, and it's a really nice way of learning and doing things, so really something that we encourage if possible within your trust, and also introducing them to the leadership team should they feel that they need to raise any concerns or queries a little bit higher up, or need a little bit more guidance from the leadership team. Okay, and so really important that yes, we support them on day one, but also that we've got that ongoing support throughout that placement. We're constantly just checking in on them and making sure that everything's okay, and ensuring that there's nothing we can do to help support them or make their experience more effective. Something that I tend to encourage, I know it's not always possible, but if you can touch base with your student at the start and the end of each day, it can really make a real impact and allow the student to kind of open up to you, and come to you if they do have any questions or concerns at any point. They know that they're going to be checking in with you each day, so they can come prepared and they can bring any questions or concerns to you should they need should they feel they need to. So if you can touch base, even if it's via email, so even if you're not going to be in the same place as the student, sending them a quick email. How did your first day go today? Is there anything you're unsure of at the moment? Are you happy knowing where you need to be tomorrow and how to get there and who you're with? And just regularly checking in, even if it's not daily, even if it's sort of halfway through the week. How is your week going? Is there anything I can assist you with? Is there anything you're unsure of? Is there anything that you feel you would like to tweak in your timetable and perhaps doesn't feel like it's working for you? So trying to touch base as regularly as you can. I know daily isn't always possible, but if it is, then that would be brilliant. Making sure that the student knows who their points of contact are. I know I discussed this quite a bit on the previous slide in terms of who can they approach for set issues, scenarios, questions, etc. But also if they want to raise a concern or they feel things aren't going well, who is it that they need to go and approach? I'd absolutely make sure they're linked in with the PEF team and direct them that way if they've got any specific placement concerns. Whereas if it's maybe a bit more of a timetabling concern or they're unsure about kind of what's coming up over the week and who's who, contacting perhaps their lead supervisor. Or it might be that they've got a concern that they're not where they need to be, and that again will likely be speaking to their lead supervisor, speaking with the PEF team, and involving their module leader or their personal academic tutor from the university as well, if we've got any concerns about them not being where they need to be and perhaps struggling at that stage in placement. But making sure that the student has a clear insight as to who to contact for what, so that they know who to go to if God forbid, hopefully not, there are any concerns or any concerns around them struggling with where they need to be. Ensuring that their learning environment is stimulating as well as supportive, so making sure that the student can get involved where possible in relation to their level of study, and trying to really encourage this active learning approach, so trying to really put the onus on the student and encourage the student to problem solve and to have a go, and perhaps to go off and find some information and then come back to their supervisor and check that they're on the right line. So really trying to encourage this active learning approach, and making sure that it's really stimulating and sort of problem based if possible, whilst also providing a real breadth of experiences, a variety of different areas that they can experience, perhaps going with different members of the team to different wards or different specialist areas within the trust, and really trying to enhance their experience as much as possible. And as well trying to be flexible with that. So something I always encourage, again I know not always possible, but if the student has a real interest in a certain area and they outline this to you once they've started placement, perhaps trying to be a little bit flexible with adjusting their timetable to try and fit in some sessions where they can go into that specialist area and they can gain some experience within that specialist area, but also being flexible in terms of if things aren't working or the student isn't picking it up or they're perhaps struggling with a certain area, thinking about how can we adapt their placement or how can we adapt our approach to support that student a little bit further. Is it that it just doesn't work the way we're doing it, and is there another way that we can approach this to support the student, whether it be adapting to their learning style, if you like, so perhaps they're a bit more of a visual learner and need to be able to see it kind of in front of them, perhaps observe you doing it first before they have a go, or is there a webinar video that they can potentially watch to support them with learning about a certain condition or what have you, that's a bit more of a visual approach to them, perhaps reading a textbook or kind of listening to somebody explaining the condition to them. Perhaps they need it to be a bit more visual and they perhaps need to either observe the condition in a consultation, or perhaps watch a video. So thinking about how that learner learns best, and having those open and honest conversations with them. You know, if they are struggling, is there a different approach that we can take to support you? Is there a certain way that you learn best? Is there something we can adapt or change to help you to digest that information or understand that information better? So really trying to be as flexible as we can and adapting to the learner. No learner is the same, and so no approach or sort of set way is going to work for every learner. So trying to be as flexible as we can with that. From a feedback point of view, trying to be as timely as we can with feedback. I know it's tricky when we've got really busy schedules and we might have overrun in a clinic and have to run on to another session, and we might not be able to give that feedback as timely as we would have liked to the learner. But at the earliest convenience, if we can give them some feedback about how we feel their consultation went, or their contribution went, I think that's really important, that we're letting them know as soon as possible, ideally straight after the event, but if not, as soon as able, if we can give that feedback, and also making sure that we're figuring out the learner's preferred style of feedback as well. Do they prefer for us to verbally give the feedback? Do they prefer for us to perhaps give it verbally but also jot it down in an email or on a feedback form so they've got it in written form? Would they prefer to go away from kind of the clinical environment where perhaps it's not quite as hectic, into a slightly more quieter space, and receive their feedback there? So just thinking about how do they respond to their feedback most effectively, what is their preferred method, and when would they prefer for you to give that feedback. I think a bit later on in the Bitesize training today, I've got a video that talks about effective feedback and how we can ensure that we're giving feedback that's going to benefit the learner. And it also talks about making sure that the learner is actually ready to receive that feedback. If they've had a really stressful clinic and a really hectic consultation, and then they know they've got to rush off to try and get to a group education session in 10 minutes, and you're saying, well, can I just tell you how you did with that consultation? They might not be ready to receive that feedback. Their brain is probably trying to keep up with everything else that's going on in their day, and actually saying to the student, would you like me to give you some feedback now? Do you feel that now is an appropriate time? Do you feel able to digest that information and discuss that information with me? Or would you prefer us to schedule in some protected time at another time where we can go through my feedback for you? So really thinking about, is the student ready to receive that feedback? And it's more than okay to say to the student, is it okay for me to give you some feedback now? Or is it okay to give you some feedback at all? Are you ready for the feedback, or do you need to step away and digest what's happened and then we can have a discussion? So really thinking about what's going to work best for that learner, and also thinking about their day and the environment as well. And remembering to be that role model, which I know we all are, working within those HCPC guidelines and within those NHS values. But remembering that we're all here to support one another, we're all here to work as a team. And it's really important that learners are feeling valued, they're feeling heard, and that they're feeling very much supported throughout their placement. And particularly, as I say, that ongoing support. So not just, hello, I'm your lead supervisor, welcome to your first day, I'll see you on your progress review on Friday. Trying to see if we can really give that ongoing support. Hello, I'm your lead supervisor, welcome. I'm going to talk you through the orientation process, talk you through your timetable. Would you like to check in with me or touch base perhaps on Wednesday, or just give me a quick email as to how things are going? And I've sent you an MS Teams link for your progress review on Friday. If you need me beforehand, give me a shout. So that ongoing support, so that the student feels like they've got a bit of a safety net. They've got someone they can approach, and they know who to go to, and they know that you're going to want to help and support them if they come to you. Okay, so moving on from that and having a little look at building a student's confidence. And I've got a bit of a scenario here for you to try and put you in the student's shoes. So I want to ask you to imagine this scenario. So imagine that you are an adult dietitian working working within oncology. That was a bit of a tongue twister. I want you to imagine you're an adult dietitian working within oncology and supporting oncology adult patients. And your colleague comes along to you and they says, right, I need you to see this paediatric patient for me. Just have a go. But I do want to watch you. I need to observe you do it. And I know you've not done it before, but you can't do it wrong. It needs to be perfect. Think about how that might make you feel. We probably are likely to feel very much out of our comfort zone and actually feel that we're probably not well equipped for that. So we probably don't have the knowledge and skills to be able to do that consultation effectively. We're likely to make mistakes or have to clarify things with our colleague that is used to doing that clinic. Whilst we learn and understand that clinic, we need to understand the process of the clinic. We need to adapt our knowledge around paediatrics and how paediatric dietetics differs to our oncology dietetics. And learn all of those processes both before and after clinic. Where are we going to document? Who do we link with? Is there a consultant we can link in with? How does the appointment system work? How do I book them in for their next appointment? All of that information that's probably very new to us. And actually we need that guidance and we need that support to be able to do this clinic well, don't we? So actually that's probably what a lot of our students are feeling like on placement. They're likely to be in a lot of new environments, unfamiliar environments with different members of staff that might do things quite differently, and so they're always constantly trying to learn, develop, adapt, figure out how this clinic works versus their other clinic. How does it work on the ward versus the community? How does that member of staff sort of go about collecting their information and documenting their information versus another member of staff? There might be different clinic performers that they need to keep up with and use. So there's lots of different things that are going on and lots of different things for the student to keep up with. And so really important that we're bearing this in mind. Yes, okay, they might be able to see a full clinic in general clinic and they're able to see every patient, they're able to document, they're able to hand over to the GP and book all of their patients into their next clinic, and they can do that really independently with minimal support. But then you might then ask them to go along to a renal clinic or a paediatric clinic, and actually they might not be able to be at that level for that because it's new, it's different, it's unfamiliar, and they need to learn and be guided on how that is different and how that works. So really important that we're remembering that and that we're balancing our expectations around that. So really important that we are utilising that no-can-do model with our students when we're thinking about supporting them in terms of expectations on placement and where they need to be at for that level and that stage of placement. So the University of Chester uses the no-can-do model, which is on their pair document. And UCLan and MMU also use something similar. It's ever so slightly different, but it does follow that kind of no-can-do approach. So try your best if you are supervising a student or you're kind of the lead supervisor for a student. Try your best to kind of familiarise yourself with that no-can-do model and understand where the student should be at for their stage or their level of study and level of placement, and it's in relation to all of their placement competencies. So should they be at the no stage where maybe they have that sort of knowledge and understanding from university but they've not had the opportunity to apply that yet? Are they at the can stage where, as for my example, they may be able to do a general clinic very independently and deliver that clinic very independently, but in another scenario, if that you were to ask them to go along to a different clinic or onto the ward or into a different setting, they might not be able to do that as autonomously, and they might need a little bit more guidance. So they're at that can stage. Whereas the do stage is being able to do tasks autonomously, independently, with minimal support, and able to do that quite consistently throughout that stage of placement. And so we're looking at that, at those three levels or those three stages, and we're looking at that in relation to their competencies to see where they should be at, and something that we should be reviewing regularly throughout their placement, as well as at their halfway point. So their halfway reviews, checking in with that no can do model and seeing, are we on track? Are there any action points that we need to put in place for the student to help support them get back on track? Is there anything that's a real focus for us? Feedback is something I am going to come on to in today's session, but really making sure that we tailor our feedback to their level and their stage of study as well. So really thinking, what is it that we're expecting of the student in this session, and tailoring our feedback accordingly. So we wouldn't want to have a P1 student go into clinic, observe the clinic, and then our feedback after clinic is, right, well, really you should be seeing all of these patients and doing everything independently, so next week we really need you to be going into this clinic, seeing everyone and being a bit more confident. That's not tailoring it to their level of study, is it? So trying to make sure that we're really tailoring that feedback so that it is in line with our expectations, it's in line with that no can do model, and that we're still boosting the students' confidence. What are they doing really well? What have they managed to complete in terms of competencies? And where do we want to focus? How can we support them to get even better and to develop and improve their practice going forward? And we absolutely want to avoid throwing students into an absolutely terrifying situation. We want to make sure that we're managing expectations. Yes, it's okay to ask them to have a little go at something they might feel a bit uneasy or nervous about if it's their first time doing it, and that's where we want to make sure that they feel guided and supported, and that they understand their scope of practice and they can ask us for support at any point. But we absolutely don't want to be throwing them into a terrifying situation. So again, that example of a P1 in clinic and asking them, okay, off you go, do you want to take this clinic today, and I'll sit back and watch and just give me a shout if you need me. That would be utterly terrifying for most of our P1 students, and it's not that tailored level for their stage of study. So just thinking about that as well, and making sure that we really try to make them feel supported and meet our expectations with the level of their study, and that they've sort of boosting their confidence. So don't put them into a situation where we are setting them up to fail. Put them into a situation where we know that they can work to their strengths and that they're going to perform well and their confidence is going to be boosted. Okay. And in terms of low confidence, low self-esteem on placement, I know it can be really common with students and learners out on practice placements, and it's really important that we're able to recognise the signs of those low confidence, low self-esteem, particularly when we think it's going to be starting to impact their practice and their ability to succeed on placement. So I've just popped a few signs that we might want to look out for with our learners to recognise low confidence levels. So we've got reluctance to participate in discussions. So perhaps you want to sit down and give the students some feedback, and they say, "Oh no, can we not today? I'm not really feeling in the right mindset to talk about that today." Or, "Oh, I need to get on with something else. Can we talk about that later?" Or you sort of give them some feedback and ask what their thoughts are, and they sort of say, "Well, yeah, I'm not sure. That's okay. Yeah." So sort of being a little bit reluctant to actually reflect on their practice and reflect on what's going well and where they can develop. Often not wanting to do that is a sign that they're feeling quite low in confidence and feeling like they're doubting their ability. You might have a student that you say, "Right, going to go through some feedback. I want you to let me know how you feel it went first. What do you feel went really well? And they go, well, I'm not really sure, I don't think it was great, was it really? Well, I didn't do that very well. And, again, another sign that they're feeling quite low on confidence and they're not actually sure if they've done anything well or if they're good at anything, which is what we want to avoid. We want to actually say, well, actually, I noticed that you did this really well and that meant that you could do this, which is brilliant. Perhaps next time, to take it further, you could have a go at doing this. So really trying to keep it as positive as possible, even when we're giving that constructive feedback. And so in terms of addressing that, if you do find a student that just doesn't want to kind of engage in discussions with you, even after you've given them some pointers and sort of talked about what went well and what they could develop, perhaps looking at setting some goals in partnership. And if you're particularly doing things like your progress reviews and saying, right, what are our action plans for next week? If you have got a student that's a bit reluctant, it's okay to say, well, I'm going to task you to come up with 3 action plans for next week. I'm going to give you half an hour or so to have a little think, look through your feedback from this week, come up with some goals, and I'll meet back with you in an hour and we can have a little look at what your plan is for next week. So really putting the responsibility and the onus on that student, but equally making sure that you're giving them some guidance if actually it's the case that they just don't really know where to start and they don't know how to perhaps put together a bit of a smart goal. Giving them some guidance, giving them some examples to go off, and then asking them to adapt that to their individual placement and their individual progress review, and supporting them that way. Reluctance to participate in service user consultations. So you ask them, would you like to have a go at weighing this patient that's going to come in next? Oh no, I'm okay, thanks. I'm not feeling ready for that yet. When we know that actually they're more than ready, or they're at that level on their placement where they probably need to be having a little go at doing that and building their confidence with that. Again, a sign that they're doubting their abilities there. And I always encourage, if you've got a student like that that's really quite reluctant to get involved in every clinic they come into, they just want to observe and they don't want to have a go, I think it's important to really try to ease them in slowly and gradually, and set quite a clear plan as to what are they going to be getting involved in each week. So perhaps week 1, yes, we would like you to observe the clinic, make note of how it runs, how does the dietitian word things, how do the processes work, what might we ask the patients, how long might we leave it before we review our patients, that kind of thing. Week 2, what we'd like you to do is welcome all of the patients in, explain the purpose of today's consultation, introduce yourself, introduce your supervisor, and then you can hand back over to me. Week 3, what we'd like you to do is to start that introduction of the consultation. So we'd like you to bring the patient in. We'd like you to introduce the purpose of the consultation, introduce yourself, your supervisor, and then we'd like you to weigh the patient, talk them through their blood results, and talk them through what we've got from a clinical point of view, ask them some questions to check that we've got that right, and then hand back over to me. Week 4, we'd like you to do that, but actually have a little go at doing a diet history as well. Or it might be you've done that really well, so this week we just want you to focus on taking diet histories, and then we're going to bring it all together later on in your placement. So doing it at a bit more of a gradual pace, but making sure that it's clear to the student what we expect of them that week. So week 1, observation. Week 2, we want you to be doing all of the welcoming. Week 3, we want you to do the weights and the bloods and the clinical information. Week 4, where you take the diet histories. Week 5, where you have a little go at implementing and formulating some care plans. Week 6, can we bring it all together and can you have a go at doing some full consultations if possible, knowing that you can hand over to me if you get stuck or you're a little bit unsure. So doing it at that gradual pace. You might find that students seem quite withdrawn, quite quiet. They might not want to go down to lunch with the rest of the team. They might not want to engage in conversation. They might just sort of keep to themselves. And so something I always keep my eye to and just check in on those learners just to make sure everything's okay and ensure that nothing is going on either inside or outside of placement. And really important that we're particularly with these learners that are appearing quite withdrawn and not really engaging in placement, that we're boosting their confidence, we're giving them lots of feedback where we can, but that we're also really checking in on their mental health and well-being. So we've got those student well-being reviews for any of our University of Chester students. So we expect those to be completed by the student weekly alongside their progress reviews, and for them to be discussing their well-being with their lead supervisor during their progress review, checking in on how things are going and highlighting if anything's not right or anything can be improved. And so really checking in on that as regularly as possible, and signposting them to their mentor, to the PEF team, to their placement buddy who is a peer from the university that they can link in with and discuss if they're feeling daunted approaching anybody from the placement or from the university. Even just speaking to a peer can sometimes really help them if they're struggling with anxiety and confidence. So just checking in that little bit more regularly if we find a student's feeling a bit withdrawn, and approaching the university so that we can provide some help and support as well. Okay, and finally we're going to have a little look at how we can make them feel valued members of the team as well. So to start with, I just want to talk about why it's important for them to feel like a valued member of the team. So we know that when they feel like one of the team, they feel included, they feel listened to, and they feel more of an employee than a student. Their confidence is very much improved when they're out on practice placement. We really see a big difference when a student is feeling very welcomed, feeling kind of appreciated, is able to make a bit of a difference towards the team. You might give them a little project or some tasks that contributes towards the team. Their confidence is very much increased and a lot higher than other students that perhaps feel a little bit isolated to the rest of the team, and they walk into the office and nobody says hello to them, no one knows their name, everyone calls them the student. You do see a difference in the learners' confidence levels. It also provides the student with that really sort of comfortable space, that environment where they feel able to approach staff members. They feel okay if they make a mistake or the consultation doesn't go very well, because they know that the team is going to support them. They know that the team has their best interests at heart, and they're going to provide them with that support to improve their practice. And it's not going to be, we hone in on everything that went wrong. We can acknowledge what you did really well, but there's also some areas that we can absolutely develop and improve. And so it creates a lot more of an effective learning environment. It also improves learners' ability to work as a team. So if they're feeling like one of the team and they're doing tasks that contribute to the team, it absolutely gets them practicing working as a group and as an MDT, and working with others as opposed to just a lone worker. We also know that it provides better job satisfaction as well. So students that do feel more included, more valued, and actually are able to support the team with tasks that's going to contribute to the team, have a better placement and provide better feedback following their placement as well, which is really important because we all have those evaluations after replacement on pair for students to complete about their experience on placement with us. So if we can make them feel very valued and heard and feel like one of the team, they're likely to give us some really positive feedback on pair as well. And it of course helps us to attract these learners to potential jobs in the future at our trust. If a student had a really positive time on placement with your team, they're more likely to want to come back and to apply for jobs at your trust as well. Okay, So how can we make them feel valued members of the team? I know we've discussed about that welcoming the student both on day one and throughout their placement as well, and it is really important that they're feeling welcomed, they're feeling like we have organised everything for them to start, we're ready for them to come, we've got everything in place. It's not all a last minute disorganisation where we don't know where they need to be, we haven't put a timetable together for them. Sorry, what was your name again? The student needs this, calling them the student, making them feel like actually maybe we don't have the time or the space for a student, and we're not ready to sort of welcome them in, and they're sort of a bit of an afterthought. That's absolutely what we want to avoid. We want them to feel welcomed, for them to know that we're ready for them to arrive. We've put a lot of work into supporting them on placement, and that we're here. We're here for them should they need anything, should they have any concerns or worries, and that they are one of the team. We will treat them as an employee. They will be invited out to lunch with us, or onto a team meeting that we're all having, or onto the Christmas do, making them feel like one of the team. Oops, I've gone too far ahead there. Viewing them, as I say, as a member of the team, including them in those team activities. Sorry, I'm repeating myself here. So including them in our team meetings, our team huddles, or MDTs that we might have as a team, any sort of additional CPD activities that we run, so journal clubs or nutrition rep lunches or anything like that, any other social activities that we might be hosting, as I say, Christmas do's, or going for a team lunch to the canteen or what have you, making sure the student is invited and included, and making sure that they feel part of what's going on in the trust. I know I talked on the previous slide a lot about sort of delegating roles to them where they can make a difference to the team and they can support with the team's workload, and actually it can really give the student that sense of responsibility and importance and feeling valued within the team. It might be something as simple as asking them to support with gathering some data for an audit, or supporting with picking a journal for journal club next month, or all engaging in their case review presentation, all coming along to watch that case review presentation and using it as CPD, and thanking the student for supporting your learning and your development as well. Or it could be something as simple as having a little to-do list of tasks that we need to do. It might be sorting through the filing cabinet and getting rid of all of those old leaflets that are outdated and replacing them with new ones. Any little tasks like that where the student can feel like they're contributing can actually really boost their confidence and make them feel like one of the team. And of course, providing that regular feedback, telling them what's going really well, telling them where they can improve, and engaging in that regular conversation and that open and honest feedback with the learner throughout their placement. Okay, and that brings us nicely onto my last topic, which is giving effective feedback to our student. And as I say, I have got a little video at the end talking about how we can give effective feedback, and it goes into quite a bit more detail. So I would encourage you to watch it if you've got time at the end of today's session. But in terms of giving effective feedback to our learners, I like to use the analogy of a feedback sandwich. So really trying to hone in on what's going well as where they can improve. So we like to sort of suggest starting with a bit of a positive comment. So when you've checked that the student is ready to receive some feedback and checked how they would like to receive that feedback, starting off with, well, can I just say you did a really great job at this, and this went really well because. Perhaps it could be developed a little bit further next time by doing this. That little bit of constructive feedback in the middle there, and then finally finishing with a really positive comment at the end. But well done, and thanks for having a go. It was really nice to see you get involved, and I think you did a really great job at building rapport with that patient. So sort of starting with something really positive, feeding it into where can we develop and take that forward, but finally finishing it off with, I think you did a great job, well done. So boosting that confidence. Okay. And I've just got some examples of how we can give slightly more specific feedback to support a student. So in terms of being effective, feedback needs to be really specific and really to give the student the ability to action it. So it really needs to follow that sort of SMART process, being specific, being measurable, being timely. So giving them something really specific to action within a set time frame, and why they need to work on that can really be the most effective way of giving feedback to a student. And I've got some examples of how we can do that here. So I'm going to start off with a piece of positive feedback for a student. So here is perhaps some feedback that could be expanded and be a little bit more specific and be a little bit more effective to the learner, so that they can actually take that feedback and action it and do something to improve their progression. So this positive feedback is, I thought your dietetic assessment went well. Okay, great, it went well. But specifically, what went well? Is there any areas that I can improve on? You know, what is it that I'm doing a really great job of, and why am I doing it well, so that I can understand that. So we might want to make that a little bit more specific. So I've popped another example of it here. So I thought your dietetic assessment was great. You had a confident tone in your voice and engaged the patient well by using good eye contact, open body language, and asking lots of open questions. This helped the patient to relax, which meant they felt they could be more open with you about their struggles. Well done. So it's telling the student why you feel that assessment went well. What was it that the student did that actually enabled them to engage the patient and get as much information from the patient as possible? It was because they had that really relaxed, open body language. They were asking lots of open-ended questions to encourage that conversation and that backwards and forwards. And they were showing that all of their concentration was on the patient. They gave them good eye contact. They were facing the patient. They were, giving their all to this consultation. The patient felt heard. So actually we've given them a lot more specific feedback there and a lot more to go off. I've got another example with some feedback that's perhaps a bit more constructive. So again, perhaps something that would maybe not be quite as effective. You need to get better at time management when seeing patients in clinic. Okay, yes, I know I overran in clinic today, but how can I get better? I don't know how. You need to guide me. You need to equip me with what I can do. So something a little bit more specific like this might work a little bit better. So we agreed that you had 30 minutes to complete your consultation with the patient this morning. I noticed that the patient seemed to control the direction of the consultation, which meant that the consultation went over the allocated time frame of 30 minutes. And it meant that the dietetic care plan felt a little bit rushed. I suggest setting a clear outline of the appointment to the patient at the very start of the appointment, and this will give you the opportunity to cut in and retake control or direction of the consultation when needed. Do you think this might help you with time management next time in clinic? So you're telling the student, we know you went over time, but this is what you can do to maybe have a little go at next time and see if you can keep on time next time. So it's outlining to the patient when they arrive, hello, Mr. Banks, today's appointment is 30 minutes long. I'd like to talk to you about your weight and your eating habits and come up with some action plans on how we can support you with managing your diabetes today. Is that okay with you? And if the direction of the consultation goes away from diabetes and into a different conversation, you can just remind Mr. Banks that we've only got 30 minutes today. I really did want to get some action points together for your diabetes. If that's your priority as well and you're happy with that, would that be okay? And you can instantly bring back that consultation and the direction of that consultation. So being a lot more specific with the student and giving them some guidance on how they can develop that is really important when it comes to effective feedback. And as I say, I've got a really great video at the end of this bite-sized training that you can have a little look at if you want to, that talks about effective feedback and what's involved and gives some really great guidance and strategies on that. But just before you go on to that, I did just want to touch on if you have a learner that is perhaps struggling when they're out on placement with you, or perhaps not where they need to be in terms of that no can do model, and what should we do in that scenario. So really important that we have clearly defined processes with this. So each of the universities will have some guidance, they will have a pathway on what to do if a learner is not progressing or is struggling. So contact us in the first instance to get some guidance on that and familiarise yourself with that pathway. Ideally, we want to be open and honest with the student, and we want to ensure that the student is aware that they're not where they need to be at this stage of placement. We might want to have a bit of an informal meeting with the student, the lead supervisor, and perhaps the PEF at the placement trust, and all have a discussion about where we're at and what we can put in place to try and get the student to where they need to be, but setting a time scale. So outlining that perhaps there is this competency that the student is not able to achieve at the moment. This is what they need to do to achieve it, and we're going to give you 2 weeks to try and get to that point. If we review in 2 weeks and we're not at that point, we're then going to a bit more formally have a meeting with the university, so the PAT or the module lead over at the university with the PEF, the student and the student's lead supervisor, and we're going to have a little look to see if we can get this student back on track and what we can do, what action plans we can put in place, again with a time scale. So thinking about that process and that pathway and linking in with the university when you feel it's needed. Absolutely, we would encourage you to contact us as early as possible, even if it's in an informal manner, just to say, we've got some concerns, we're not sure about this, please can we meet with you and go through it and just see what we can do to support. So letting us know as early as possible, really, if we can support and help in that scenario. It might be that you have that informal meeting with the student, you put some action plans in place and you're able to get them to where they need to be without our support. But please do reach out if we can support and help you with any students that perhaps aren't progressing or where they need to be when they're on placement. Okay. So thank you very much for listening to today's bite-sized training session. You've got a few more left to complete before we see you at our in-person sessions. So I hope you enjoy the few that you've got left of those bite-sized training sessions. And as I say, I've got a little video at the end of this session all about giving effective feedback. So I will play that now. Equally, if you want to come back and have a little watch of that at another time, I will pop it on a separate slide on the PowerPoint so that you can go along and have a little look at that in your own time. But thank you very much. Thank you for supporting our learners, and best of luck with the rest of the training. Thank you.
If you look at like a carpenter, they have a toolbox. A dentist, they have their drills. In our era and the type of work most of us are doing, the tool we most need is actually centered around being able to give and receive feedback well. Humans have been talking about feedback for centuries. In fact, Confucius, way back in 500 BC, talked about how important it is to be able to say difficult messages well. But to be honest, we're still pretty bad at it. In fact, a recent Gallup survey found that only 26% of employees strongly agree that the feedback they get actually improves their work. Those numbers are pretty dismal. So what's going on? The way that most people give their feedback actually isn't brain friendly. People fall into one of two camps. Either they're of the camp that is very indirect and soft, and the brain doesn't even recognize that feedback is being given, or it's just simply confused. Or they fall into the other camp of being too direct. And with that, it tips the other person into the land of being defensive. There's this part of the brain called the amygdala, and it's scanning at all times to figure out whether the message has a social threat attached to it. With that, we'll move forward in defensiveness, or we'll move backwards in retreat. And what happens is the feedback giver then starts to dysregulate as well. They add more ums and ahs and justifications, and the whole thing gets wonky really fast. It doesn't have to be this way. I and my team have spent many years going into different companies and asking who here is a great feedback giver. Anybody who's named again and again, we actually bring into our labs to see what they're doing differently. And what we find is that there's a 4-part formula that you can use to say any difficult message well. Okay, are you ready for it? Here we go. The first part of the formula is what we call the micro yes. Great feedback givers begin their feedback by asking a question that is short but important. It lets the brain know that feedback is actually coming. It would be something, for example, like, do you have 5 minutes to talk about how that last conversation went? Or I have some ideas for how we can improve things. Can I share them with you? This micro yes question does 2 things for you. First of all, it's going to be a pacing tool. It lets the other person know that feedback is about to be given. And the second thing it does is it creates a moment of buy-in. I can say yes or no to that yes or no question. And with that, I get a feeling of autonomy. The second part of the feedback formula is going to be giving your data point. Here you should name specifically what you saw or heard and cut out any words that aren't objective. There's a concept we call blur words. A blur word is something that can mean different things to different people. Blur words are things that are not specific. So for example, if I say, you shouldn't be so defensive, or you could be more proactive. What we see great feedback givers doing differently is they'll convert their blur words into actual data points. So for example, instead of saying, you aren't reliable, we would say, you said you'd get that email to me by 11, and I still don't have it yet. Specificity is also important when it comes to positive feedback. And the reason for that is that we want to be able to specify exactly what we want the other person to increase or diminish. And if we stick with blur words, they actually won't have any clue particularly what to do going forward to keep repeating that behavior. The third part of the feedback formula is the impact statement. Here you name exactly how that data point impacted you. So for example, I might say, because I didn't get the message, I was blocked on my work and couldn't move forward. Or, I really liked how you added those stories because it helped me grasp the concepts faster. It gives you a sense of purpose and meaning and logic between the points, which is something the brain really craves. The fourth part of the feedback formula is a question. Great feedback givers wrap their feedback message with a question. They'll ask something like, well, how do you see it? Or, this is what I'm thinking we should do. But what are your thoughts on it? What it does is it creates commitment rather than just compliance. It makes the conversation no longer be a monologue, but rather becomes a joint problem-solving situation. But there's one last thing. Great feedback givers not only can say messages well, but also they ask for feedback regularly. In fact, our research on perceived leadership shows that you shouldn't wait for feedback to be given to you, what we call push feedback, but rather you should actively ask for feedback, what we call pulling feedback. Pulling feedback establishes you as a continual learner and puts the power in your hands. The most challenging situations are actually the ones that call for the most skillful feedback. But it doesn't have to be hard. Now that you know this 4-part formula, you can mix and match it to make it work for any difficult conversation. If you look at like a carpenter, they have a toolbox. A dentist, they have their drills. In our era and the type of work most of us are doing, the tool we most need is actually centered around being able to give and receive feedback well. Humans have been talking about feedback for centuries. In fact, Confucius, way back in 500 BC, talked about how important it is to be able to say difficult messages well. But to be honest, we're still pretty bad at it. In fact, a recent Gallup survey found that only 26% of employees strongly agree that the feedback they get actually improves their work. Those numbers are pretty dismal. So what's going on? The way that most people give their feedback actually isn't brain-friendly. People fall into one of 2 camps. Either they're of the camp that is very indirect and soft, and the brain doesn't even recognize that feedback is being given, or it's just simply confused. Or they fall into the other camp of being too direct. And with that, it tips the other person into the land of being defensive. And there's this part of the brain called the amygdala, and it's scanning at all times to figure out whether the message has a social threat attached to it. With that, we'll move forward in defensiveness, or we'll move backwards in retreat. And what happens is the feedback giver then starts to dysregulate as well. They add more ums and ahs and justifications, and the whole thing gets wonky really fast. It doesn't have to be this way. I and my team have spent many years going into different companies and asking who here is a great feedback giver. Anybody who's named again and again, we actually bring into our labs to see what they're doing differently. What we find is that there's a 4-part formula that you can use to say any difficult message well. Okay, are you ready for it? Here we go. The first part of the formula is what we call the micro yes. Great feedback givers begin their feedback by asking a question that is short but important. It lets the brain know that feedback is actually coming. It would be something, for example, like, do you have 5 minutes to talk about how that last conversation went? Or I have some ideas for how we can improve things. Can I share them with you? This micro yes question does 2 things for you. First of all, it's going to be a pacing tool. It lets the other person know that feedback is about to be given. And the second thing it does is it creates a moment of buy-in. I can say yes or no to that yes or no question. And with that, I get a feeling of autonomy. The second part of the feedback formula is going to be giving your data point. Here you should name specifically what you saw or heard and cut out any words that aren't objective. There's a concept we call blur words. A blur word is something that can mean different things to different people. Blur words are things that are not specific. So for example, if I say, you shouldn't be so defensive, or you could be more proactive. What we see great feedback givers doing differently is they'll convert their blur words into actual data points. So for example, instead of saying, you know, you aren't reliable, we would say, you said you'd get that email to me by 11, and I still don't have it yet. Specificity is also important when it comes to positive feedback. And the reason for that is that we want to be able to specify exactly what we want the other person to increase or diminish. And if we stick with blur words, they actually won't have any clue particularly what to do going forward to keep repeating that behavior. The third part of the feedback formula is the impact statement. Here you name exactly how that data point impacted you. So for example, I might say, because I didn't get the message, I was blocked on my work and couldn't move forward. Or, I really liked how you added those stories because it helped me grasp the concepts faster. It gives you a sense of purpose and meaning and logic between the points, which is something the brain really craves. The fourth part of the feedback formula is a question. Great feedback givers wrap their feedback message with a question. They'll ask something like, well, how do you see it? Or, this is what I'm thinking we should do. But what are your thoughts on it? What it does is it creates commitment rather than just compliance. It makes the conversation no longer be a monologue, but rather becomes a joint problem-solving situation. But there's one last thing. Great feedback givers not only can say messages well, but also they ask for feedback regularly. In fact, our research on perceived leadership shows that you shouldn't wait for feedback to be given to you, what we call push feedback, but rather you should actively ask for feedback, what we call pulling feedback. Pulling feedback establishes you as a continual learner and puts the power in your hands. The most challenging situations are actually the ones that call for the most skillful feedback. But it doesn't have to be hard. Now that you know this 4-part formula, you can mix and match it to make it work for any difficult conversation.